Hi, I am Dr. Reviewer Marajayach, working as Assistant Professor in the Department of Kaya Chikitsa, SDM College of Ayurveda and Hospital, Hassan, Karnataka. I would like to thank Team Jitnyasa for giving me an opportunity to talk on the topic Rasayana in Ayurveda. Ayurveda is the science of life, and Rasayana Chikitsa has been given a prime importance as one of the octopartite forms of Ayurvedic categorization because it is ubiquitous and unique to Ayurveda. Rasayana in its entirety cannot be understood in a period of 5 to 10 minutes. Rather, I would like to give you an overview on the aspect of Rasayana in geriatrics, that is Vardhakya Vikara, and the aspect of Rasayana in the treatment of specific diseases, that is Vyadhihara Rasayana. Geriatrics, it is an age of senescence. It is the age of frailty. If you look into the graph of the catabolic and the anabolic activity, then it is skewed towards the catabolic activity. And hence, there will be severe degeneration as well as diminution of the cells and the tissues. Also, there will be a reduction in the physiological reserves of the body. There will be reduction in the activity of the cardiovascular function. The renal system will be hampered. The respiratory system will be having plummeting in its function, and also the other physiological reserves will get reduced. The sensory system will be hampered, where symptoms such as hypogeusia, symptoms such as anosmia will develop, and also in memory there will be severe derangement. So diseases such as Alzheimer's, diseases such as dementia, they develop in this age group. Senescence is where the quality of the life of the patient is getting reduced. There are two aspects to aging. One is aging in terms of years, where the patient might be 70, 80 or 90 and they will be bedridden. And there is another aspect where it is known as healthy aging, where the patient is 70 or 80 but their quality of life is very good and they will be able to do their routine daily activities such as sitting, standing and walking on their own. So this is where the use of Ayurveda and this is where the effect of Rasayana comes. There has been studies where the usage of Amalaki Rasayana increased the lifespan of Drosophila. So it was an animal study that was conducted in a specific research institute. Similarly, Rasayana like the Brahma Rasayana, Bhargavaprokta Rasayana, Amalaki Rasayana can be given in the age group of geriatrics, can be given in Vardhakya Vikaras, so that the quality of the life of the patient will be increased and their day-to-day routine activities can be performed by themselves without any outside help. And we'll go into the second aspect of Vyadhihara Rasayana. In the Uttarasthana, the 40th chapter, where the Agraushadhis are being mentioned, there are specific Aushadhis for specific diseases. So let's take an example. There is Shilajatu, that is applicable for almost all the diseases. There are properties like Rasayana, properties like Yogavahi, properties like Lekhana for Shilajatu, which makes it an apt medication that can be used in Avaranajanya Vatavyathis. If there is Kaphameto Avarana of the Rasarakta Hastrotas, then Shilajadu is the best suited medication. If there is Kaphamedo Avarana in the Rasarakta Hastrotas of Shiras, it will lead to Shiromarbha Bigada. If it is in the Hridaya, it will lead to Hridroga. Understanding in contemporary terms, if there is atherosclerotic plaques that is being formed and vascular insufficiency is created in the circle of Willis, in the MCA, ACA territory of the circle of Willis, it can lead to cerebrovascular accidents, infarction. If the coronary circulation is hampered in the heart, it will lead to myocardial ischemia or myocardial infarction. And Shilajadu Rasayana can provide wonderful results as a prophylaxis in maintaining the condition. Then there are medications like Guduchi, which is indicated for Vatarakta and Amavata. Vatarakta and Amavata are umbrella terms, wherein autoimmune disorders such as the systemic lupus erythematosus, rheumatoid arthritis, several autoimmune related disorders such as the seronegative spondyloarthropathies, Sjogren's syndrome can be included. Again, some of the chronic diseases known as the scleroderma, again also known as the systemic sclerosis, wherein the symptomatology is in close relation with that of the symptomatology of Vata Rakta and symptomatology of Amavata. So Guduchi Rasayana, if it is implemented in autoimmune disorders, it is going to provide better results for maintaining the status of the disease rather than curing it, because autoimmune disorders are difficult to cure. It can be controlled to a certain extent with the applicability of Guduchi Rasayana. Then again, I'll give you an example of Lechana Rasayana. It can be utilized in diseases such as intervertebral disc prolapse, amyotrophic lateral sclerosis, and motor neuron diseases, which is a severe neurodegenerative condition which is progressive. And there has been wonderful results in using Lechana Rasayana in these conditions in Dhatukshay-janya Vyathi as well as in Marga-Avanajanya Vata Vyathi. On using Rasayana, a few points has to be kept at mind, and they are the selection of the medication. Unless and until you select the proper medication that has to be given in a specific disease, there is no point in continuing the Rasayana therapy. The other forms of details that has to be taken care of is the dosage of the medication. The third one is the Anupana that has to be given along with the medication, and also the duration for which the medication has to be given. So these 4 points has to be taken care of while giving Rasayana Chikitsa. And hence, I'll wind up the session by saying that Rasayana is a very promising treatment methodology, which is a novel method of treatment which can be used as a prophylaxis, which can be used as an adjuvant in the treatment of diseases, in the treatment of Vardhakya-janya vikaras also. Thank you.